Thank you for joining me for Emerging Infections Update Monkeypox Virus. My name is Margot Savoy. I'm Senior Vice President of Education for the American Academy of Family Physicians. I have no significant disclosures to report. After completing this lecture today, you will be able to describe the current prevalence of monkeypox virus infection in the United States, identify patients who have suspected infections, name prevention strategies, and perhaps most importantly, review where you can locate additional information during this evolving situation. Monkeypox is a viral infection caused by monkeypox virus. Monkeypox virus is the same family as variola or smallpox, but it is not related to chickenpox or varicella, even though there's pox in both of those titles. Monkeypox was named because when it was first discovered in 1958, there were 2 outbreaks in lab monkeys of a pox-like disease. However, it turns out other animals can actually be infected as well, including humans. In fact, the first infection in humans was recorded in 1970. Currently, we think that animal hosts include monkeys, but also other rodents. And historically, it's been an infection limited to a pocket of countries in central and western parts of the African continent. The Centers for Disease Control and Prevention routinely track cases of monkeypox virus and other infectious diseases. The map on the slide shows you the global counts for monkeypox virus at the time of this presentation, but know that they're continuing to rise. So to see the current case rates of monkeypox virus, please visit the CDC website. What is most significant to note is that the cases that are represented in orange are the current infections that are currently occurring in parts of the world where monkeypox virus historically has only been seen rarely. As of July 29, 2020, 20,804 cases, or 98% of the cases that are occurring, are happening in locations where monkeypox virus is not typically reported. And what's interesting is that while it's typically limited to only 7 countries where you see monkeypox virus routinely, currently it's being reported in 78. This is what's making the global concern, and the United States currently has the largest monkeypox virus case count in the world. Within the United States, monkeypox virus cases have been identified in all but 4 states. While these numbers may seem small, keep in mind that in a typical year, we only see maybe 5 cases of monkeypox in the entire country, and this year we're already in the thousands. Now that we know there's a need to be on the alert for cases of monkeypox virus in the United States, what exactly are we even looking for? Let's walk through the clinical course of monkeypox virus, starting with exposure or infection. Monkeypox virus is typically spread through person-to-person contact. This can include direct contact with either the rash, scabs, or body fluids of an infected person, or even from their respiratory secretions. We do not yet know whether the infection can be spread through vaginal or seminal fluid, but it can pass through the placenta. People who come in contact with infected animals, either by being scratched or bitten by them, or by eating the meat from an infected animal, can also be infected. Of an interesting side note, it's called monkeypox, and so we often think about it as being in monkeys. However, in the United States, animal transmission has occurred more commonly through pets. For example, prairie dogs who were kept at home, but had been infected by being housed close or near an infected other animal. For you, thinking about this as physicians, keep in mind that you can also pass and catch monkeypox virus infection through aerosolizing procedures on an infected person. So this means that if you're performing an aerosolizing procedure, particularly on someone's secretions, skin lesions, or suspension of dried substances or exudates, that you need to be wearing protective equipment, and so do those around you. In fact, anyone within 6 feet of that procedure ought to be wearing protective equipment. So even your assistants should be being careful to not catch monkeypox while doing these sorts of aerosolizing procedures. Monkeypox can spread from the time the symptoms start until the rash has fully healed and a fresh layer of skin is formed. The illness typically lasts about 2 to 4 weeks. The incubation period can be as short as 4 to 5 days, or it can last up to 2 weeks. But once a person starts having symptoms, they're considered in the prodromal phase. In this prodromal phase, the infected person has symptoms such as fever and chills, myalgia, fatigue, URI symptoms, and headaches. I know I groaned when I heard about these symptoms because they overlap so strongly with other infections that are circulating. So, for example, SARS-CoV-2 or influenza. There are some things that make it a little bit different. So, for example, monkeypox virus infection has a tendency to cause lymphadenopathy. This can be both generalized or more localized, for example, in the inguinal area or in the axilla or in the neck area. That's not quite so common with COVID 19 or with influenza. Also, with monkeypox virus, you tend to see more of a low grade fever as opposed to the high numbers that you tend to see with influenza. Finally, without thinking about the rash too detailed quite yet, know that you can get this viral exanthem. And typically with viral exanthems, we notice that you get the rash and then you get the fever. But in this case, with monkeypox virus, you actually get the fever first. So they'll have a fever and then they'll go on to develop the rash. And that makes it a little more characteristic of monkeypox virus than some of the other viral exanthems that we see. Once a person starts having symptoms, they will quickly move into having this characteristic rash of monkeypox virus. The typical rash of a person infected with monkeypox virus is going to look a little bit different depending on what stage you see it in, because it actually goes through stages. It starts with just being visible, and so then you end up having a macular rash, so that rash that you can see, that you can't actually feel if you were to touch it, to being more papular, where it's actually both visible and palpable, so you could feel it if you were to touch it, to vesicular, so filled with fluid, to pustular, when that fluid goes from being more clear to being more cloudy and actually filled with more of a purulent material. And then ultimately that blister is going to break and it'll form a scab and crust over. And then eventually the scab itself will heal and fall off on its own. The skin that is below that scab tends to heal back to normal without scarring, although it is possible to get a pigment change or scarring on the other side. Typically, the rash is going to occur on particular parts of the body in groups and clusters. So you'll find that, for example, the rash will show up in one place and all of the lesions in that area will be around about the same stage of healing. You will notice, though, that there can be different stages of healing all across a person's body. And monkeypox virus tends to affect the extremities more so than the trunk, but you can have a rash on any part of the body. Please be aware that this rash can be incredibly painful or uncomfortable for patients who are experiencing it, particularly when it gets to the papular and vesicular stage. People will describe significant discomfort or pain. Sometimes this can be affected by where it happens to be located. So, for example, if it's in the inguinal or groin area, it can be particularly uncomfortable, but the rash is just uncomfortable no matter where it shows up. By the time it gets to that more crusted healing phase, you'll find that people describe it being more itchy than it is so much painful. But we do go through a significant period of time where people are having a very, very significant amount of discomfort from this rash. The CDC also provides a pretty helpful table that you can see on the screen that sort of outlines the time course of the various rash stages, so that if you were trying to get a feel for which parts are sort of at what stage of healing or where the patient is on their infection time course, you might be able to do that a little easier by using a table such as what you're looking at here. Recovery from monkeypox virus infection typically takes about 2 to 4 weeks. Most cases are mild and self-limiting. Severity is going to depend on the initial health of the individual at the time of their exposure. The strain of the circulating virus can also be important. Typically, the skin heals with no remaining issues, but like we mentioned before, you can actually get pitted scars or some pigmentation changes after the scabs have fallen off. Once the scabs have all fallen off on their own, so you do not want the patient picking at them to try to speed that up. Once they've fallen off on their own, the person is no longer considered contagious. It's actually unclear whether monkeypox virus is actually going to confer lifelong immunity once you've been infected. We're hoping that that's going to be the case. We do see that with smallpox. Once you've been infected with smallpox, you have lifelong immunity. We're hoping that's going to be true for monkeypox, but it's not clear at this time. Testing a suspected patient for monkeypox virus infection really should involve a call to your local health department or the lab that you're planning on sending the specimen to, because there's some really specific details that you want to be clear about, and you want to make sure that they're prepared to receive your sample. In general, the CDC recommends testing directly from the active lesions. You don't need to unroof the vesicle, but you definitely need to take a vigorous sample. And you need to get samples, at least 2 separate swabs from 2 different areas on the body, but you want to do a clean swab with each one. One thing that's important to note is that you're going to want to use a synthetic swab, so a cotton swab is not appropriate to be used in this space, although it doesn't matter what the handle type is made out of. And you definitely are going to want to have viral transport media, because universal transport media is not appropriate for specimen collection at this time. Generally, we're going to be sending these specimens frozen or on dry ice, but you really do need to check with your local health department or the lab who's going to be receiving it to make sure that you're providing it in the way that they need. During the COVID-19 pandemic, we've been seeing a rise in many sexually transmitted infections and diseases. Please note that some of these produce a rash that looks quite similar, particularly if they happen to be located in the inguinal or groin region. So if you're not sure, or if you're thinking that a person has symptoms that are suggestive of monkeypox, it is recommended that you actually test them for other STDs at the same time, just to make sure that you're not confusing one infection for another. Some things to consider include syphilis testing, herpes, and chancroid, particularly if you notice that there are genital lesions. Because monkeypox virus is generally self-limited, most people are, again, not going to need treatment outside of supportive care. But for those who do require treatment, you have to know that we don't have a medication that's specifically indicated for monkeypox virus infection itself. Fortunately, the antiviral agents that are used for smallpox, such as tocilizumab, appear to be effective if needed, but we only really use them for severe infections. We also have Vaccinia Immune Globulin Intravenous, or VIGIV, which can be used for inpatients if they're having severe disease. But in general, most of us that are managing this in the outpatient setting are going to be doing symptomatic care alone. The CDC does recommend vaccination for people who have been exposed to monkeypox and for those who are more likely to get monkeypox. Those that are more likely to get monkeypox include contacts of someone with monkeypox virus infection, sexual partners who've been diagnosed with monkeypox virus infection, people who have multiple sexual partners in a location where there's an outbreak or known monkeypox virus circulating, or if their job exposure demands it. So, for example, people who are working with lab specimens. When properly administered before an exposure, vaccines are effective at preventing people against monkeypox virus. There is no actual monkeypox virus vaccine. However, ACAM2000 and Jynneos are both two currently licensed vaccines in the United States that prevent smallpox and can be used in this situation. The vaccines are effective, but they are different. Although both are live vaccines, ACAM2000 is a replicating vaccine. What that means is that you'll actually get a lesion at the site of the inoculation, and that lesion becomes fluid filled, and the fluid in that space can actually be used to infect another person, or it can be auto spread if you were to scratch or move it to somewhere else on your body. On one hand, this is actually a really effective way of getting vaccinated. It allows for a much quicker time to get to being fully protected. However, it does come with that risk of spreading it to someone else or auto inoculating and spreading it on your own body. On the other hand, Jynneos does not replicate. So there's no actual visible take lesion. So you don't actually get that spot that might have infectious material. But because it doesn't, you actually need to have a second dose. So you're going to get a dose at time 0, a second dose 4 weeks later. And then it's not until 2 weeks after that second dose that you're actually considered fully protected. Monkeypox is a virus that, as we mentioned before, is transmitted person to person through skin-to-skin contact with people who have a rash or through respiratory secretions. So you do need to advise patients that they're going to have to limit their contact with their loved ones or household contacts while they're actively infected. Washing your hands with soap and water or using alcohol-based sanitizer is advised. There may be some other recommendations that might not seem so obvious when you're thinking about monkeypox virus infections. So, for example, avoiding close contact with your pets or other animals. And if you were to have a pet or animal that started to develop symptoms, that they need to be taken to the vet and evaluated for management. You want to avoid putting in contact lenses to prevent infection of your eye from getting any of the infected fluid from a lesion into your eye. You want to avoid shaving the infected area to limit spread. You want to take care with soft or upholstered furniture or mattresses that can absorb the oozing or the weeping from the infectious materials by accident. That could cause you to spread the infection to other folks in the family. Also, you want to consider using a separate bathroom or an uninfected space in the household so that you're not having both those who have no infection and those who are infected using the same bathroom facilities. Partly because you're going to be changing dressings and doing other sort of personal care in those areas. And you want to make sure that we're not leaving material on the bathroom seats or handles that might be spread. And so the best way to do that is going to be using just a separate bathroom altogether. If that's not possible in that particular patient's living situation, then being thoughtful about using an improved sanitizing product would be really a great idea. They have a list of all the household products that can be used on the CDC website. Additional information that can help you with the diagnosis, management, and counseling of patients around the prevention of monkeypox and the infection can be found on the AAFP website, as well as there's additional guidelines and information on the CDC website. Both of those websites are shown on the screen. Here are the references in case you're looking for additional information. And we thank you again for your attention today and really appreciate you being a member of the American Academy of Family Physicians.